Look at the sheer volume of data we navigate daily. We live inside a constant, high-speed flow of endless updates, messages, and inescapable notifications. You are at an event, and suddenly there is an overwhelming urge to capture the moment, to get a picture and post it immediately. Or your phone buzzes, and you feel that undeniable rush to check the notification. Millions of people interact with these apps constantly and manage a healthy balance with the rest of the world. At what specific threshold does this ubiquitous modern convenience cross the line into a destructive behavioral pathology? For some, the compulsion to update and respond stops being a choice. It crosses over into a clinical addiction, operating on the exact same destructive mechanics as alcoholism or drug abuse. This is a progressive disease. Over the course of its manifestation, it actively compromises an individual's mental health, degrades their work performance, and systematically steals their overall quality of life. The onset of this disorder creates a surprisingly cold and detached environment for the user. The most immediate physical symptom is the sheer volume of time consumed. The afflicted spend an exorbitant amount of hours with their phones physically in their hands, constantly scrolling, typing, or uploading at the expense of other activities. This creates extreme sociological detachment. You will see individuals sitting in family or social situations, completely isolated from the gathering, physically present in the room, but entirely mentally absent. They actively abandon hobbies and physical activities they previously enjoyed, replacing those outlets entirely with continuous mobile app engagement. Psychologically, the disorder manifests as a compulsion to overshare personal details and feelings. Users begin embellishing aspects of their daily lives, driven by a need to curate a fabricated, highly enhanced online presence. We also look for performance degradation as a key diagnostic marker. This inescapable, constant engagement directly results in poor performance in the workplace or at school. The initial manifestation systematically strips away genuine human connection and real-world achievement, leaving the individual with a highly anxious, entirely artificial digital existence. When the digital screen goes dark, the user experiences the crash. These are severe physiological and psychological withdrawal symptoms that strike the moment they are disconnected from their stimulus. The subject feels a sudden onset of intense, almost physiological panic. They experience profound emptiness and anxiety, wondering what's happening on their feed. If the digital stimulus continues to be withheld, that initial spike of acute anxiety rapidly devolves into a state of clinical depression. Self-esteem drops drastically. This loss is driven by a myriad of online comparison factors and the extreme isolation of withdrawal. The physical toll extends into the patient's rest. Severe sleep disruptions arise, driven by the persistent, anxious need to remain engaged with their apps at all hours of the night. The severity of the digital crash proves that social media addiction carries dangerous, real-world withdrawal symptoms identical to those found in chemical dependencies, trapping the patient in a vicious, repeating loop. Breaking the cycle requires professional clinical intervention. One of the primary recovery methods is cognitive behavioral therapy, or CBT. CBT is a psychological treatment that focuses on identifying and changing destructive thought patterns. Licensed therapists use these techniques to help patients explicitly identify and confront toxic thought patterns. The ultimate goal is to provide patients with actionable mental tools to create healthy boundaries and rebuild a managed relationship with their devices. These clinical methods are highly effective. The exact same therapeutic frameworks that have successfully maintained my own sobriety from alcohol and drugs for 8 years apply directly to breaking technology addictions. While many individuals successfully balance constant digital interactions with the real world, if you are finding that these apps are interfering with your relationships and your life, you must step back and evaluate your habits. Recovery is highly accessible today. Patients can reach out to a variety of online therapy providers, which offer large databases of licensed professionals to choose from. Social media addiction is a devastating and progressive disease. But recognizing the clinical symptoms and seeking professional help gives individuals the power to restore their reality and regain control over their quality of life.